Welcome to Let's Eat. I'm your host, Emily, holistic health coach and self-proclaimed wellness enthusiast, here to meet you at the intersection of physical and mental health, the exact location where optimal wellness lies. This podcast is meant to explore all areas of mind and body wellness, designed to offer you the integrative knowledge, behavioral strategies, and mindset shifts necessary to uplevel your health and feel better today. We'll explore nutrition, sleep, movement, self-care and stress management, habits and routines, gut health, mental health, and more. I am so happy that you're here. Welcome to the table. Let's eat. Hello, everyone, and welcome back to Let's Eat. Today, I have a special guest with me, and we're talking all things sleep. Dr. Sarah Silverman is my guest on today's episode. She is a Stanford-trained holistic sleep specialist, insomnia expert, and wellness consultant who's passionate about sleep, health, and wellness. Now, if you know me at all, you know I too am very passionate about sleep, health, and wellness. And we both agree that in a lot of ways, sleep is the foundation to our health. Dr. Sarah and I discussed her approach to those with insomnia through the use of CBTi, which is cognitive behavior therapy for insomnia. I'm really familiar with CBT because of the work that I did with clients as a therapist. So it was really interesting to see how this methodology is also used to help support clients in a drug-free approach for those who struggle with chronic insomnia. CBTi is an effective way to improve sleep naturally and overcome chronic insomnia without medication. Sarah and I talk about a few suggestions and tips on how to best support your sleep. She shares that, getting quality sleep starts in the morning. And so really understanding what are the factors that are in my control that can help support better quality sleep. She explains that there's a genetic component to it, right? So we talk about epigenetics and doing certain testing to help support and understand what areas you might need extra support in, or why this might be the case that you struggle with insomnia or difficulty sleeping, the difference between insomnia being a condition versus being a symptom, and we really explore the ins and outs of sleep from a holistic standpoint. So I thank you for being here. I hope that you enjoy this episode. More details about Dr. Sarah are listed in the show notes if you're interested. And I hope that you will join me in welcoming Dr. Sarah to the table, and let's eat. Hello, Sarah. Thank you so much for being here today. I'm super excited to have this conversation with you, to talk all things sleep and to learn a little bit about the work that you're doing in the world of sleep and holistic sleep and all that good stuff. And I'm just so grateful to have you here today. So thank you.
Thank you so much for having me. It is an honor to be here. I so appreciate you reaching out, and I'm so excited to chat all things sleep with you today.
Yes. So we'll just dive right in, right? Sleep is such a complex topic, especially in the world of health and wellness. And unfortunately, I don't think it's given the spotlight that it deserves next to exercise and nutrition. And I had mentioned to you before we hopped on our call that some experts even suggest, and I would absolutely love to hear your thoughts on this, that sleep is almost more important than the food that we're eating and the exercise that we're doing or we're not doing. And it's simply because of what sleep is doing to our body and to our minds when we are in fact not sleeping versus the days that we are sleeping, right? And sleep deprivation and the epidemic that is that. And so I'm wondering if you could just kind of get started, let's talk about sleep. Why is it important? What have you learned over the course of your time in this field as it relates to sleep and its importance on health? And give us the scoop.
Yes. Well, this is certainly a question that we could talk about for days and days, because there isn't a system in the body that doesn't get affected by our overall sleep quality. And
Sure.
I like to think about our sleep as our brain health, because it very much is related to how our brain essentially clears the toxin waste from the day. And it's almost like what I like to call a car wash. every night we, have to go through our sleep car wash in order to reset and make sure that our brain is ready to tackle each day and function optimally.
Sure.
So I'm biased, of course, but I do believe that sleep is the foundation of our overall health and not just a pillar of health, where, diet and exercise are often thought of as pillars of health. I believe sleep is the foundation, and then we have those pillars that are ultimately influenced by our sleep quality. So when we think about how important sleep is, it's to me, it's the most important thing. And when your sleep is dialed in, then all of these other areas are, able to, well, let me put it this way, it's kind of like a domino effect.
Sure.
Your sleep isn't the way that you'd like it to be, or you're not getting the best quality sleep on a regular basis, that is going to influence what types of foods you may choose to eat,
Sure.
how motivated you are to complete a workout, or even be able to, have the energy to work out or motivation to get through your day and be productive. And so sleep really does impact the other pillars of health. And so it's kind of like the foundation, the starting point that I wish I could shout from the rooftops, start with sleep, and then all of these other things will follow. And that's
Sure.
not to say that, these other areas, they're so, so important, of course, but when our sleep is dialed in, then we can focus on these other areas that also impact our overall well-being. So when it comes to our sleep health, you name it. I mean, it influences our cognitive health, the way that we can make good decisions during the day, the way that we make good judgment calls, our ability to plan, organize, have conversations with people. Another really big area is our mental health,
Yeah.
how mood is. And I know that everyone, can relate after a not so great night of sleep. Of course, we're feeling a little bit more irritable or cranky.
Sure.
There's such a big mood component to our sleep, and it's a very complex bi-directional relationship. And so they influence each other tremendously. And also physical health, of course, when we're not getting enough sleep, when we're not getting the amount of sleep that our body actually needs, it can really start to take a toll on our immune system. A lot of people may feel under the weather, actually get sick. There's just so many areas of our overall well-being that are impacted by the foundation.
Yeah.
And so it is, to me, really the starting point. And that's also something that I've learned over the years is, a lot of people will try to start with diet and exercise when they're on a health journey. And while some people may see great success there, they're often forgetting the sleep piece and
Yeah.
how much that really does make a difference. Where, a lot of people will wake up at 5 a.m. to go to a workout. And it's like, well, if you're compromising your sleep for a workout, it's
Yeah.
necessarily going to be the best long-term approach. So
Sure.
you name it, sleep affects that system of the body. And it truly is the way in which your brain not only clears that detoxin waste, as I mentioned, during the night through our lymphatic system, but it's
Yeah.
also the way the brain essentially it allows us to complete all of our daily functions. And we
Right.
want to be able to do them at our best and feel our best as well.
Mm-hmm. Yeah, I couldn't agree with that more. I think this whole concept of the foundation, it really realigns the way that you see sleep in comparison to nutrition and exercise and stress management and all the other pillars that we consider being important for our wellness. When we think our foundation, okay, if foundation is compromised, then none of those pillars can actually stand and really reinforce, right? If the foundation isn't there. And so, kind of reframing the way that we see health just in that alone, I think speaks volumes to its importance. And I love that you mentioned the lymphatic system because this is something that
Yeah.
I only recently learned about, I think probably in the past year, maybe. And I find it so fascinating. And I think it's such an important part of obviously our brain health. And it's an important part of understanding the importance of sleep. But just really kind of conceptualizing what that means for your brain over the course of, one week of poor sleep or several months of poor sleep, but sometimes it's out of our control, right? With stressors and circumstances, and if you work wonky hours, and there's all these factors. I can't just say it's a blanket statement, but it really does give you a greater grasp on, wow, there is so much importance for me to consider what my quality of sleep is looking like, how I can improve it better, and not simply just dismiss, oh, I'm just not a good sleeper, or I don't know, it is what it is, right? And I have a very hard time hearing that, and I am determined to question that, allow people to call into question for the sake of this just overall better health.
Yes, I love that. And I'm so glad that you said that because that's something I hear all the time. With the clients that I work with, it's, oh, well, I've always been a bad
Yeah,
sleeper, or I've always been a light sleeper, I've always been a poor sleeper. And it's almost like a lot of folks will take on that identity and really feel like there isn't much they can do
sure.
to change their sleep. And that is absolutely not the case. I mean, there's so much that we can do that goes far beyond what you may read online or see on social media, which are generally sleep hygiene practices or healthy sleep habits, which are very important, and they are things to always be putting into practice, but sometimes they aren't enough if your
Sure.
sleep is at a point where you maybe are now having what may be considered a primary sleep disorder like insomnia, for example.
Sure.
So yeah, it's certainly an area that I tend to work on with clients as far as changing mindset around sleep and really
Mm,
on this identity that you can sleep well. We all can sleep well. In fact, the drive for sleep is biological, so it is innate to us. We all have the ability to sleep, but the way that we sleep is often learned. And for a lot of us, a lot of those habits or behaviors or even thoughts and beliefs around sleep get ingrained at a very early age,
yeah.
and that kind of carries into adulthood for most folks. And it's so interesting because we think about how rigid or strict we are with babies and sleep training, and even with kids having a set bedtime routine and making sure that they go through their routine, but then at some point when we become adults that kind of goes out of the window.
Yeah.
Just like babies and kids need sleep training, adults do too. And so that's very much the way that I like to think about the work that I do. It's really learning how to sleep well because the ability to sleep is within all of us.
Yeah, right. I think that's like such a powerful way of saying it. It's like it's not like you're exempt, or it's not that you weren't born with the gene or the biology that foregoes the need for you to sleep. Like everyone needs it. And yeah, I think that's a really, powerful point to make is you have the capability now. Like let's look at your environment, like let's look at the circumstances, and let's look a little bit deeper so we can understand what are the factors that are inhibitory, and then go from there, because I think that that gives the people a little bit more of a sense of empowerment, knowing like you are just as much wired to sleep as the next person. It's just a matter of how you're cultivating a healthy sleep routine, which obviously we know most of us are not doing. So what sparked your interest into sleep? Tell me a little bit about kind of your journey, your background, what led you down this path to end up as someone who really focuses on sleep.
Yeah, yeah. Well, thank you for this question. I, like many people who maybe are in the healthcare or related fields, have had personal experience with sleep issues. And so I can certainly relate when it comes to not only getting enough sleep, but then also having bouts of insomnia.
Okay.
And the irony of all of this is my sleep journey kind of started, well, actually, I should say it's pretty much been lifelong, but it really got worse when I was in graduate school. And the irony, of course, studying to become a sleep specialist. So my formal training is actually as a clinical health psychologist.
Okay.
So it's a little bit of a different training, even from those who end up pursuing, say, a program in clinical psychology, where my training was in medical centers, hospital settings, and I would actually work with patients when they're in the hospital and not necessarily doing therapy with them, but actually going to the bedside after, for example, someone was in a car accident or someone was shot or actually came in with a physical trauma, and actually would stay with them at the bedside to provide support while they were in the hospital. So these are people who weren't necessarily asking for psychological support. So it's kind of an interesting way of providing um, therapy in a sense, but not in the traditional way that people think about it.
Yeah.
So, long story short, as part of my training, of course, being in the hospital setting, when you're in the hospital, the biggest complaint from patients is, I can't sleep. The nurses keep waking me up every 4 hours to check my vitals and all of that.
Yeah. Yeah.
It's very true. I mean, we want our sleep time to recover, especially from really serious injuries.
Sure.
Then the system is set up to kind of interfere with our sleep process. So as I was going through my training and I started to see how much sleep was a complaint and how much that really impacted someone's recovery, I decided to specialize in sleep psychology. So it's actually a very small subspecialty of clinical psychology where psychologists can then specialize in this area of sleep. And it's also referred to as behavioral sleep medicine. So it's thinking about sleep from more of a holistic approach and also more so about the behaviors or habits
Okay.
that might be keeping people stuck in poor sleep habits. So when I was in graduate school training, actually at the age of 24, I was going to class, working rotations in a clinical setting and seeing patients, and also working 2 jobs. And I ended up, unfortunately, having a transient ischemic attack, or a TIA, which is also known as a mini stroke.
Okay.
And that was kind of like my rock bottom, because at
Yeah. Yeah.
24, never thought that that would even be a thing. And so I ended up in the hospital. Of course, doctors ran a bunch of tests, and lo and behold, the conclusion of why I ended up, having the TIA was likely due to chronic sleep deprivation, because I
Okay.
really wasn't sleeping.
Yeah. Yeah.
Maybe just because of my schedule, I was maybe sleeping a couple of hours a night, and then I was
Right.
kind of all over the place just with my work schedule versus class schedule. And so I was really burning the candle at both ends, and my body just collapsed
Yeah.
essentially.
Yeah.
So
Yeah.
that was really my wake up call. And, after that happened, I really wasn't practicing what I was preaching. So, of course, I had to kind of do a 180 and, start to implement some of the things that I was helping people with. And
Yeah.
so, and of course, sleep is never going to be perfect, and there's always going to be life that gets thrown our way. But that was really the turning point for me. And then, of course, ended up really pursuing this as a specialty. And this is all I do these days, is just really help people with their sleep issues, and really from more of this holistic non-medication approach, so that people have a long-term plan for
Yeah.
sleep success, as I like to call it.
Yeah. Yeah. Well, and honestly, I'm sorry to hear that you went through that. And, I
Thank you.
empathize with you because I think it it is I personally have gone through different health, circumstances and parts of my journey that really have now kind of shaped what I do now. So I think, if anything coming out of it is now you have this passion and this drive to help others stay away from something of that nature, right? Or to avoid or to better educate them and empower them on the importance of sleep so that something like your circumstance or like your situation or something maybe much worse, right, that could take place, doesn't in fact actually end up manifesting based on simply just the fact that you aren't getting enough sleep, right? And I think that you are a living testament to the fact that, yeah, that's a very strong possibility that things like this can happen. And it's important conversation to be had, you know?
Yes, thank you for saying that. And while, I would never ever want to go through that again, it does
Sure.
give me such a personal, it really helps me understand what my clients are going through,
Yeah,
because
yeah,
they know what it feels like to be walking around like a zombie every day and just,
totally.
feel like you're going through the emotions. And I know that there are probably so many people listening that can relate to that, where
Yeah,
feel like you're just going through the day as best as you can. And sometimes that is the season in which we might be in. But really recognizing that sleep has to be a priority so that you don't end up experiencing something like a TIA. And of course,
sure,
that's very rare. I will say that it's very rare that that would happen. But, it's certainly, we want to prevent things
sure,
like that from happening if we can.
sure,
And sleep is very much prevention, it's preventative care. So
totally.
thinking about it as, let's prevent these things from happening.
Yeah. Yeah, absolutely. I think prevention is the best medicine. That's something that I firmly believe in. And so sleep is no exception to that. You had mentioned, and we don't have to get too far into this topic, but you had mentioned going about it in a way that doesn't include medication or like a non-medication approach. And I've heard bits and pieces about sleep aids and medications meant to help support sleep and how are they actually serving us in the way that we think they are, or is it maybe just a temporary relief? Like, what are your thoughts on that? I don't want you to feel like you have to kind of go off on the medication side of things just for the sake of, keeping us on track here, but I just be curious from your own experience and what you know about medications that are so quickly prescribed, in relation to what that's actually doing to our sleep and our quality of sleep.
Yeah, no, I love this question because I help my clients come off of sleeping medications
Sure.
and aids. However, at the same time, I know how incredibly helpful medications can
Yeah.
be. So I like to think about medication or, even over-the-counter sleep aids as a tool. And just like any other tool, when they're used appropriately, they can be incredibly helpful.
Right.
A lot of the clients that I work with do typically start working with me when they're on some form of a sleep aid or even prescription sleeping pills. And unfortunately, in the world that we live in, medication is often the first thing to be prescribed when someone isn't sleeping well.
Sure.
And so while, eventually, if it is someone's goal, we'll come off of the sleep aid, I think in the short term, they are a very helpful bridge. So can provide temporary relief, can help to stabilize sleep and get things back to a little bit of a more consistent place. And they also can help take away some of the worry or anxiety that sometimes develops around not being able to sleep well.
Sure.
So they do serve a really great purpose, and I have seen them be incredibly beneficial for many of my clients,
Right.
but they aren't the best long-term solution.
Yeah.
And
Yeah.
just really starting to scratch the surface in terms of what potential long-term health consequences some of these sleep aids could potentially lead to.
Sure.
Even some over-the-counter sleep aids like Benadryl, diphenhydramine. There's some new data around Benadryl as a chronic sleep aid. So just because it's over the counter doesn't necessarily mean, it's off limits either.
Yeah. Yeah.
So, I think on the one hand can be an incredibly helpful short-term tool, but on the other side of this, they are, simply a band-aid. And the goal is to be able to learn a very long-term solution, and that's going to look different for everybody.
Sure.
So there's a time and a place, just like any other tool in someone's toolkit. And so they can certainly be helpful, but kind of as that short-term bridge until someone can really learn what's going to best support them through lifestyle changes and mindset shifts around sleep.
Yeah. Yeah. I couldn't agree with that more. I think that that's the perfect embodiment of, treating the root as opposed to the symptom. And for a time being, it can be relevant, can be important, and can be utilized, but maybe not so much for the long term. And I think alongside that, which I'm sure that this is something that you do while you're undergoing that transitional process with a client, you're also meeting them with the education about why it's not something that's long term. Because I find this is something that I come across in my work is because we have been raised in an environment, in a culture that's very pharmaceutically driven, we don't really bat an eye at being on medication long term, right? It's simply just like, oh, okay, well, I'm depressed, so I'm going to be on this antidepressant for the the long term, and this is just part of my medicine cabinet, and it is what it is. But I think when we start to really look at what you're saying in the sense of we can see the need for it in a period of time, but also committing to the fact that it's not going to be something that's maybe long term, that's a really just different alternative way of looking at medicine versus our healthcare system, which maybe is more medicine driven, pharmaceutically driven, and so forth. And so kind of being able to dance alongside them in that process of like, yeah, this for the time being serves us in a way, and that's all cool, and we can do it and it works. But let's also consider what maybe 6 months from now looks like, maybe what a year from now looks like, and start to integrate more of those empowerment strategies for them to feel like, okay, there are other ways to go about this that won't require you to depend on the medication in order to do that. Thoughts on that? I think that that's kind of coming from just my own, how I see our healthcare system in America and our culture versus maybe a more holistic approach to things, the disparity that's there.
Yeah, I 100% agree with you there. And I do believe that when most people go to their doctor, and it's more so kind of a systemic issue, but most
Sure.
doctors are going to prescribe some type of medication for sleep. And part of the problem here is that the first line treatment approach for insomnia, as an example, is cognitive behavior therapy for insomnia, or
Mm-hmm.
CBTi. And that's through the American College of Physicians recommendation, the National Institutes of Health. So most doctors do know that this is the first line approach, which is a non-medication treatment approach. However, there are less than 800 specialists in the world who provide CBTi.
Mm.
So it is very difficult for doctors to be able to refer to a CBTi provider because there's just not many of
Not
us
enough.
to
Yeah.
count.
Yeah.
And so it is unfortunately the case. I do think that this specialty is growing, but for right now, it is unfortunately the case that most people will get prescribed medication until they can find someone who, say, specializes in CBTi, or someone who is more focused on treating insomnia from a non-medication approach. So I
Yeah.
think it's part of it too. And then also a lot of doctors will prescribe medication and they don't really talk about the risks of long-term.
Yeah.
May
Yeah.
not also talk about what a realistic exit strategy might look like. And so a lot of people are just kind of left to deal with this on their own and don't really have the tools to make the changes necessary to get them off. And so that's certainly where someone like myself can come in. But again, it can be challenging to find one of us, since there's just not a lot of us to go around.
Yeah, absolutely. Absolutely. Yeah. And I think that's unfortunate. And I think there's obviously so many other barriers when it comes to finding alternative medicine, alternative, approaches to health, right? Because insurance is involved and just locating a provider that even has availability. And if you're paying out of pocket, there's all these, so it definitely is so much more challenging than just saying, I'm just going to see my primary care doctor and see what they have to say. And usually, I don't want to speak for all. I'm certainly not a medical practitioner by any means, so I don't ever want to speak out of line in this regard. But most primary care doctors or doctors are going to organically divert to the medication route, given the fact that that's just their training and that's just how they've kind of been taught to support their patients. So tell us more about CBTi. I'm really curious. As someone who has a background in mental health, I'm very, very familiar with CBT. That was a big part of the work that I did with clients. CBT and DBT were very much on the forefront of my practice. And even now as a coach, I kind of pull in flavors of that without calling it CBT, right? Because I want to maintain my ethical boundary. But at the same time, it's just, you can't argue with its effectiveness. You can't argue with how it makes sense. So I'm curious to hear how CBT is relevant to insomnia specifically and what that looks like in practice.
Yeah, thank you for this question, because there are a lot of folks who maybe have heard of CBT, but not CBTi.
Hmm.
And while it does stem from traditional CBT, it definitely has a different flavor. It definitely feels a little bit different than, say,
Okay.
traditional CBT or talk therapy. So the way that I like to describe it is it very much feels more so like a workshop or a sleep class, because a lot of the treatment is actually correcting a lot of misconceptions about sleep. Since we know there's so much information about sleep out there these days, it's really sometimes hard to know what's actually science fact, what's actually worth knowing.
Yeah.
Which is just so much, so many myths out there as well. So there's a huge psychoeducation component of CBTi where it's actually learning what healthy sleep looks like versus what may be a sleep disorder. And as the name suggests, there's a cognitive piece and a behavioral piece. So the cognitive piece really focuses on changing any negative thoughts or beliefs around sleep that might actually be getting in the way of either falling asleep or getting back to sleep. Or for
Sure.
a lot of people, they might even be thinking about sleep during the day. So it's really focusing on how to reframe or shift those negative thoughts and beliefs.
Okay.
The behavior piece is focusing on any behaviors or habits around sleep, before sleep, also during the day, that might be impacting overall sleep quantity and overall sleep quality. So
Okay.
it's the combination of targeting the thoughts, beliefs, and the behaviors and habits that usually leads to improved sleep quality. There isn't usually just one thing that does the trick. It's
Yeah.
usually a combination of sorts.
Sure.
And everybody is so unique when it comes to their sleep and their preferences for sleep. So while there are, very specific techniques as part of CBTi, I do find that we have to modify them or make them a
Yeah.
little bit more flexible to make them really work for each individual, since we want this to be a long-term solution.
Yeah.
So
Yeah.
it's very structured in the sense in that we know there are very specific techniques that have been shown now through decades of research to be much more effective than just sleep hygiene,
Sure.
sleep practices. But it's really coming up with a personalized and sustainable plan for each
Yeah.
individual. So there's, very specific techniques, but then there's also a very big educational component as part of the
Mm-hmm.
treatment.
Yeah, I love that. I love that it's, like you're saying, it's general in the sense of the protocol or the structure of CBT as it is, but then you're also looking at through the lens of an individual person and what it is that their needs look like, their circumstances, what thoughts they're having, and so forth. So as it relates to like maybe an example, I guess I want to understand, especially because a lot of what I see as a coach and what I definitely saw as a therapist in my clients was that stress and anxiety were the most influential drivers of poor sleep. Like that was just hands down. I mean, they could have had, too much sugar after dinner or staying up all night on their phones and scrolling and blue light and all that, which obviously, as a result of that, can generate stress and anxiety, right? But it was
Yeah.
more just about the rumination and the thoughts and the what do I have to do tomorrow, or why did that person say that to me, or just lots of like doom and gloom and all of that, right? Which happens when we get silent. And I think this is obviously a byproduct of our unwillingness to be quiet and be alone with our thoughts over the course of the day. And now we're forced to. And I think that's a big part of this. So if you were to have like, just kind of like a general example that you could offer when it comes to implementing this strategy, what would that look like? Kind of give me like just a general example of how this is put into play.
Sure, absolutely. And I do really love this question. And I think it might be helpful to also tease apart CBTi from sleep hygiene so
Hmm.
that your listeners can really also identify the differences here. So,
Sure.
sleep hygiene, those are going to be practices that we all see. So, things like don't eat too close to bed, don't work out too close to bed, don't drink alcohol too close to bed, cut your caffeine off earlier in the day, ideally around lunchtime. Um, what else? Reduce screen time before bed, limit screens, all of these things that are very important. They are incredibly important.
Sure.
But what ends up happening for a lot of people who may develop insomnia, as an example, is they're doing all this sleep hygiene hygiene practices. They may actually even, you know, be perfect with sleep hygiene. And also their bedroom is, you know, dark, a cool temperature, quiet, all those good things as well. Their sleep environment is optimized. But the sleep hygiene practices are not really moving the needle. They're not really enough. And what's interesting is when we look at the research on CBTi, many of the research control groups are actually given sleep hygiene. So we know that when we compare CBTi to sleep hygiene, CBTi is much more effective than just sleep hygiene alone. And again, sleep hygiene is very important. Those practices are great. However, they are really designed to maintain good sleep if you already have good sleep.
Okay.
So
Yeah.
the term sleep hygiene actually also stems from this whole idea we have in regards to dental hygiene. You know, dental hygiene, you go to your dental hygienist every 6 months or so to get your cleaning, and that helps to maintain good oral health if you already have good oral health. But if you have a cavity or you need a root canal, well, then you have to see the dentist, right? You have to have that specialized treatment to correct the problem.
Yeah.
And so it's kind of along the same lines as sleep hygiene is great to maintain good sleep if you already have good sleep. But if you have a sleep problem, like insomnia, or even another sleep disorder like sleep apnea, for example, or restless legs syndrome, which is also very common, then it makes sense that we would have to see the specialist. And so those are good practices to always keep in mind, but they may not be enough when we're dealing with something that it now moves into the territory of being more of an actual problem, an actual disorder.
Okay.
So CBTi is not sleep hygiene, although they can look similar. And nowadays, because CBTi is gaining some traction, there is some overlap. I will, you know, come across some things online where I'll say, oh, you know, that's actually a technique as part of CBTi. It's not sleep hygiene. And so it kind of muddies the water for a lot of folks. And I'll give you the perfect example of that, which I think would also kind of tie into your question. There is one specific behavioral technique as part of CBTi. It's called stimulus control. And it's the practice of keeping your bed as just a place for sleep. So ideally, bed equals sleep. And you want to stay away from doing too many wakeful activities in bed for a prolonged period of time. Because over time, what ends up happening for a lot of folks is your brain starts to associate being awake with being in bed. And it muddies sleep versus wake. And so the actual practice of stimulus control, when someone with insomnia, for example, is looking, or whenever they may feel like they are lying awake in bed for a long period of time, or whenever the stress or the worries kick in, you don't want to be spending too much time in bed if you're thinking about a bunch of things, whether they're good, bad, or somewhere in between. It still communicates to the brain that your mind is very active and overthinking. So the general rule of thumb for this technique is, you know, 15 to 20 minutes goes by and you're still wide awake and you know that sleep isn't going to happen anytime soon. You actually want to physically get up and out of bed and ideally go into another room. And in the other room, you want to keep dim light. So ideally incandescent lighting. And you want to actually do something that you would enjoy, but that's also calming to you. So getting up and out of bed, going into another room, doing something that you would enjoy. So maybe it's reading a book, listening to music, listening to a lighthearted podcast or something along those lines. I'm also a big fan of adult coloring books or playing a crossword puzzle, a word search, putting together a jigsaw puzzle, something like that. That's kind of lighthearted. And then the idea is you stay out of bed until you feel sleepy again, and sleepy, and you can get back into bed and fall asleep within 15 to 20 minutes, give or take. So that's a practice that for many of my clients, they'll repeat sometimes a couple times during the night. And that goes for the beginning of the night, so initial sleep onset, but it can also be throughout the night when awake in order to manage that prolonged wakefulness. And over time, the brain starts to learn that bed is just for sleep. And that's truly the best way that we know how. It's classical conditioning. It's physically getting up and out of bed,
Yeah.
removing yourself from the bedroom so that your brain can actually relearn that bed is just for sleep. And so
Yeah.
that's where that practice comes into play.
Yeah, I love that. I think, these are such tangible skills and habits that we can immediately implement, right? And it's just about really examining your sleep hygiene if you have sleep hygiene at all, right? Which I think a lot of us
Mhm.
don't. A lot of us are laying in bed with our laptops and shutting that and then expecting ourselves to get to sleep immediately thereafter. But really understanding the importance of it and making it like ritualistic, right? Making
Mhm.
it to a point where it is a part of your day, a non-negotiable part of your day for the sake of the quality sleep you have at night. Because I think in our culture, we've really put sleep on the back burner, or I'll sleep when I'm dead, or,
Mhm.
oh, I'm good. I only need like 4 hours of sleep and I'm good to go. And yeah, okay, there's different chronotypes and everyone's different and whatnot, but you are
Yes.
still in a danger zone of sleep deprivation if you're telling me you're only getting 4 hours of sleep, right? So, I think just bringing more attention and more awareness to the importance of all this through sleep hygiene and really making it a part of your day that, just as you would brush your teeth or do, the day-to-day tasks that you already have, make this also a part of that priority, you know?
Yeah, I love
Um,
that. You're right
yeah,
about that. It's, just as we would brush our teeth, ideally you should become just part of your routine and how you
sure.
lay down and prepare for bed. And so, yeah, what a lot of my clients find is with CBTI, especially, a lot of the techniques are fairly straightforward. They're not rocket science. However, they are very strategic.
Sure.
And so it comes to a lot of my clients' surprise, like, once we kind of go through all of the techniques, it's like, well, I thought it was going to be maybe this magic thing. And it's like, well, of course that doesn't exist.
Yeah,
But it's not about doing a ton of things. It's actually about learning the right techniques, the right
sure.
strategy. And also, of course, there's the mindset component as well. But it's actually learning very specific techniques, and there's not that many, but they are effective because they're strategic. And
Right.
of course, that also requires us really personalizing them to each individual.
Sure, sure. Yeah, I think that's a nuance to, or I guess that's just what differentiates us in a more holistic wellness space from the prescriptive nature of our healthcare system and one size fits all and all of that. Especially for CBT and like you said, there's a little bit of a difference, but from what I understand about CBT, like obviously it's going to be so different from person to person because we're talking about their thoughts, we're talking about their emotions, we're talking about the subsequent behaviors, and that's not going to look the same on every person, right? Maybe there's a host of irrational thoughts, cognitive distortions that might be there that are influential in a similar way as the next guy, right? But really being open to tailoring it in tandem with what you said about the sleep hygiene and so forth. It sounds to me that that can be a really effective way to go about improving sleep quality and addressing conditions like insomnia and so forth. And hopefully, alleviating some of that difficulty as well. So when we think about traditional healthcare versus a functional healthcare, holistic healthcare, right? Maybe we can say Western medicine, Eastern medicine, however you want to phrase it. A lot of times we look at issues like insomnia, and even I would even go as far as to say is maybe sleep apnea, um, anything in the world of difficulty with sleeping, right? Anything that prevents you from getting good quality of sleep, whether it's restless leg or just general restlessness, not being able to get to sleep at night, which oftentimes, could be relevant to cortisol issues. The list goes on. When we talk about the debate, and I don't even know if it's in a debate, but the way I see it is I think we look at insomnia in our country as being a condition. And I would be curious to hear from you about your thoughts about, is it a condition or is it a symptom of some sort of underlying imbalance, some dysfunction, some sort of nutritional concern, metabolic concern? There's a number of different driving forces that could create something along the lines of insomnia. But I think within our healthcare system, we're quick to say it's a condition and here's a medication, here's a sleep aid for it. So I'm wondering, between the two camps, I guess you could call it, where do you stand? Like, how do you feel about that? What comes to mind for you when we kind of talk about this and the differences there?
Yeah, thank you for this question because it's a debate amongst the sleep community as well, and it has been for many years. Originally, insomnia was thought to be a symptom of something else. So whether it was a metabolic issue, pain related, could very well be glucose related, thought to be a symptom of some other condition.
Sure.
And that was a running theory for many, many years. And then in more recent years, which I think would be more the traditional side of medicine, insomnia is now thought to be a primary problem, a primary sleep disorder. And I could certainly see both sides, and I do weigh both sides because I think it does depend on the person as
Sure.
well. I have seen many cases of insomnia where it's very clear that it's not a symptom of something else. It's very anxiety driven and it's
Yeah.
very specific and doesn't present in the way that it might look when it's a symptom of
Sure.
something else. So I
Right.
really do think that it depends. But the more conventional medicine side of things now looks at this as, well, it is a primary sleep problem. So yes, let's treat with medication. Let's hopefully refer to CBTi. So there is that side of things. And while that can certainly be true for many individuals, I do also believe, and I have seen this as well, that insomnia is often a symptom of something else that is going on in the body.
Sure.
It, from my approach, being much more holistic and maybe more on the functional side, I like to think about sleep from mind, body, and spirit
Mm,
approach. And so I do often see that insomnia is caused by a number of different ailments, and it could, very well be related to someone's digestion. It could very well be, what someone's eating and their blood glucose. It could be very much hormone related. I mean, all of this is very multifactorial. So there is this constant debate between, well, is it an actual primary condition or is it a symptom?
sure.
And the answer isn't clear. I think it depends. It could go either way. And I think it really does depend also on the practitioner and their view on whether or not it is a primary problem versus a symptom of something else. And what I do know based on the research that has been done specifically with insomnia, and this is where I think the line of thinking around it being a primary disorder comes from, is because we've actually done quite a bit of data with insomnia and other mental health conditions like depression and anxiety, and also quite a bit of research with insomnia and chronic pain.
Mm,
And what we know is when we can treat the insomnia, then these other areas also improve. It's not the
sure.
other way around.
Sure. Yeah.
So, that kind of leads into that line of thinking. Well, if that's the case and we can treat insomnia and all of these other areas improve, well, then that might be the driving force. That might be the
Yeah.
primary problem. So, again, I think it depends on the provider and their view of things, but certainly it also depends on the individual and how their insomnia presents.
Yeah. Okay. Yeah, that makes a whole lot of sense. And I love that point that you bring up about how, we can be so fixated. So say for example, insomnia being a symptom of depression, right? But then if we look at insomnia as being, okay, let's look at this, let's treat this, and then you subsequently see the depression, reduce or subside, or the quality of life improves, right? We'll put it generally
Yes.
speaking in those terms. Then you kind of wonder, okay, well, what came first, the chicken or the egg, right? Or it's like I'm able to address this because I know to be true that insomnia, or I'm sorry, lack of sleep has a direct impact on our brain, has a direct impact on our gut health. And so
Mhm.
if I'm able to address this and allow someone to get the quality sleep that they need in order to support neurotransmitter production and a healthy gut and all of that comes along with depression, then I might be able to see improvements as opposed to the other way around, right? Like let me treat the depression and then see what happens from there. Does that make sense? It's kind of like
Yeah.
we need to look at it in a way that maybe we can look at lifestyle first and foremost towards these more, well-known mental health concerns or even physical health concerns, and maybe approach it in a different way than what we commonly see. And it
Yeah.
sounds to me like there was success in that. So that's pretty significant.
Yes, absolutely. And, I'll also just mention a lot of my clients will already be seeing a therapist or psychologist for the treatment of anxiety or depression or trauma or something along those lines. And yet their sleep isn't improving.
Sure.
So it's often, a referral to a sleep specialist like myself in order to treat just the sleep piece. And they're still, getting the treatment for these other areas. But if the therapist or psychologist doesn't specialize in sleep, sometimes that's overlooked.
Yeah,
And
totally.
in on this side of things, where insomnia is thought to be a primary problem, it should be really the first step. And
Yeah.
so that way, these other areas can resolve or improve. And as you said, I mean, really speaks to improving someone's overall quality of life at the end of the day.
Right. Yeah, and I couldn't agree with that more where, luckily individuals can be referred to someone like you to help support them in the sleep specific arena. But I think when it was coming from my perspective as a therapist, given what I knew about lifestyle and nutrition and sleep and so forth on mental health, it was a really difficult space for me to be because I'm seeing clients who have the expectation that I'm going to give them coping skills, we're going to talk things through, there's lots obviously of that goes on. And then there was also the part of me that said, well, I know your sleep and your nutrition and your gut health and all of these things, just your ability to get sunlight in the morning, right? All of these factors are having profound influence on your anxiety and on your depression. And I really kind of was pushed up against a wall when it came to how do I support these clients, meet them where they are
Mhm.
because of the understanding that that is my ethical responsibility, and also essentially deliver this information to them that could be transformative for their health, and it got to the point where I ended up resigning from my role. And that wasn't necessarily the primary reason. There's a number of other things that played into it. But I think I felt like I couldn't really fully be the helper that I wanted to be because clients just weren't in the headspace to accept that, yeah, your sleep and your food and all of these things are going to make a big difference on how you feel. And trying to overcome that barrier and still be patient and still meet them there, it took a big toll on me as a clinician in order to just be patient with the fact that, yeah, okay, I can't expect them to grasp this even though I know with my whole heart that it's going to help them. So that was something that I faced too when it was trying to navigate the healthcare system that we know, that talk therapy, all very effective, right? Not going to say that it's not, but there's this missing piece to that puzzle that I think I just didn't have the opportunity to fully kind of enforce in the work that I was doing.
Yeah, absolutely. Thank you for sharing that. I mean, I can absolutely relate to that as
Yeah.
well.
Yeah.
There's, very a lot of modalities that are incredibly helpful and that work for a lot of folks, but sometimes it's not enough. Sometimes there
Yeah.
are some very key areas of lifestyle behaviors, lifestyle change that go overlooked. And so, yeah, I agree with you. Sometimes there is a big missing piece of the puzzle as
Sure.
to why clients may not improve or not see as much improvement as they'd like.
Yeah. Absolutely. Absolutely. Yeah. Big part of that. And there's resistance there. And trying to work through that, it's just, it's hard. It's really hard, when you, especially when you feel so strongly about something and you know how much of an impact it could have. It takes a lot out of the clinician, right, to be okay with, accept the fact that, okay, they're just not ready, right, or they're
Yeah.
just not going to be at a place. I can do what I can based on where they're at, and that's all I can do, so work to be done, to say the least, especially in mental health,
Yeah.
around this type of topic. So I'm curious now to kind of get into a little bit more about your specific approaches and so forth, I want you to explain to me what is night owl optimization, and you can also get into delayed sleep phase syndrome, depending on their interrelatedness and how you want to kind of explore both of those for someone who's maybe unfamiliar.
Thank you for this question.
Yes.
Delayed sleep phase. You mentioned chronotypes a little bit earlier, so I think this is actually a great segue off of talking about what being a biological night owl might look like. And so delayed sleep phase is actually considered a circadian rhythm disorder. And I do see a lot of folks with this condition. And when it comes to what this looks like in real life, when we think about chronotypes, so someone's unique circadian rhythm and whether or not someone identifies as being more of a morning person, more of a night owl, or somewhere in between, chronotype is thought to be genetic. It's thought to be predetermined. So we all have a genetic predisposition to either feeling like we're more, early birds versus night owls, or again, some people are in between. And I like to actually think about chronotype as existing on a spectrum. So while, some people fall more on the early side, some people are going to fall on the much later side. And then there's going to be people who, feel like they function best in the afternoon. So chronotype is important in this conversation because, and this is something I tell all of my clients, I think it's so important that we all know what our chronotype is and what that looks like, because
Sure.
yes, we think about chronotype in the case of sleep and where you might find your best sleep to be, meaning your, optimal sleep window when you naturally might feel sleepy and wake up and what that looks like. But also when we know our chronotype, it can help us determine what time of day we might be able to get the most work done. We might be
Sure.
able to be productive or alert, the time of day that we might actually prefer to work out, the time of day we might prefer to do things. So it really does play a role, not just in terms of our sleep, but also our day to day and what might feel best for us in terms of how mentally alert we'll feel, and also just our mood and what time of day you might feel your best.
Hmm.
So delayed sleep phase is really what some folks would call being an extreme night owl or a very extreme evening chronotype.
Okay.
So when you think about what a typical sleep schedule might look like, and this is really, what we tend to see online on social media, like a classic 10 p.m. to 6 a.m. or
Sure.
11 p.m. to 7 a.m., something like that. And most people will fall into a schedule like this.
Okay.
In the case of someone who has a delayed sleep phase, this individual doesn't feel sleepy until typically after 2 or 3 in the morning. And so it's not that they can't sleep or that they can't fall asleep. It's that they're timing up their clock, their intrinsic body clock, their circadian rhythm is shifted much later than what society deems as a typical sleep schedule.
Sure.
So typically it's 2, 3, it could be even later than that. I mean, I've seen as late as 6 a.m., 7 a.m. bedtimes. So it can really be extreme depending
Yeah.
on who you are.
Yeah.
And of
Okay.
course, in the world that we live in, which caters very much to early birds, those who have a delayed sleep phase disorder, they really struggle with working, a typical day job
Sure.
or a typical work schedule, a typical day
Mm-hmm.
shift. It
Mm-hmm.
makes it very challenging to work and live in a society that is very much, 9 to 5.
Yeah.
So I personally don't like that it's referred to as a disorder or a syndrome because these are people that don't have a problem sleeping. It's that there's a mismatch between their internal rhythm
Sure.
and society, our social norms, our
Yeah.
environment. And so when it comes to night owl optimization, it is very individualized because those who do fall into this category are typically going to be more on the extreme side of things.
Sure.
So optimization can look very different, but generally it is trying to either work with someone's biological sleep schedule
Okay.
or work with to slowly shift their schedule into a desired window that's going to help them more closely align with their preferred work schedule or
Sure.
school schedule, you name it. So it is challenging, I will say, because it's actually not psychological, it is neurological. It
Okay.
is a shift in the timing of someone's circadian rhythm. And so these are folks who really do struggle to live in our 9 to 5 world.
Yeah,
So
yeah.
the optimization piece really does look a little bit different, but generally it is helping someone shift to a more desired schedule if we can.
Okay. So desired as in what is expected, I guess, of like a functioning adult in American
Yeah.
culture? Like, or at
Yeah.
least kind of like getting yourself to a space where it's a little bit more manageable.
Yes, correct. So,
Okay.
so my I do tend to see more of the severe cases here. So, for example, someone who maybe their biological bedtime is 4 or 5 a.m., it might be realistic for us to be able to shift to say like at 1 or 2 a.m.
Sure.
That's a little bit easier on someone who has to get up at 6 or 7 for work.
Yeah. Yeah, sure,
When
sure.
you think about this disorder, I mean, those who really do fall into this category and who have to wake up early for school or for work, they're not getting enough sleep. They're
Yeah.
losing sleep. It's chronic sleep deprivation. It's
Yeah.
very different from insomnia. It's a completely different problem. It's more so the timing of sleep that
Yeah.
is mismatched and makes it very challenging to function. So yeah, it's coming up with a more realistic schedule based on someone's work schedule or whatever they
Yeah.
have to get
Yeah.
up every day.
Okay. So do you find this is an issue with like shift workers too? And is there any guidance that you can suggest for, I mean, that is my dad has owned his own company for 40 years, and this year he's actually retiring, and he's always worked at night. And I grew up thinking that that's what dads did. I was like, yes, this is
Mm-hmm.
just what dads do. He would sleep in the afternoon, and over the course of the years, it's shifted. He's going in to the city less frequently, and he's kind of began to wind down given the retirement is on his way, and he's in his mid 60s, so it's time for him to kind of cut back. But over the course of this time and what I've learned about sleep and sleep deprivation and shift work and all these just irregularities in sleep schedules, like the damage that can be done alongside that, I know is pretty intense. But I'm just wondering, obviously my dad's case aside, like for someone who does have no choice but to work those types of positions, how does one navigate that in order to still feel like they are getting the sleep that they need and honoring their body in the best way that they can, right? Because if you're completely out of whack from what your body's wanting and what your body needs, I'm sure that can't fare well for their functioning and just all the issues that can come along with having disrupted sleep.
Yeah. Yeah. I really appreciate this question because I know there's so many people who are shift workers. And, when someone does have some form of a circadian rhythm disorder, whether it's delayed sleep phase, there's also advanced sleep phase where they go to
Okay.
bed very early and wake up very early. They don't typically have as much of a problem because they're already up very early,
Sure.
but typically before the sunrise. But, we could even think about circadian rhythm misalignment when
Okay.
someone's traveling across multiple time zones
Oh
on a regular
yeah.
basis. That would also be a circadian disruption. So shift work is really hard. I mean, delayed sleep phase, you could also argue you're essentially a shift worker
Yeah.
every day. Someone who isn't getting enough sleep because you're just not getting sleepy until the wee hours of the night. And so, yes, it is this mismatch between your internal clock and your environment. And so that could very much lead to some of the known health consequences that we know now in terms of shift work. And, I still think that there's a lot of research to be done in this area. And I know that there are a lot of health problems that are also multifactorial.
Sure.
Sleep probably is a big factor there, but there are so many other factors that also
Sure.
play into
Yeah.
developing, some serious health consequences. But when it comes to circadian rhythm misalignment or circadian rhythm dysfunction or shift work, the goal in working with someone who maybe has a schedule that doesn't align with their internal clock is to come up with a compromise. And so in the case of shift work, what I do find is actually a lot of night owls will end up, choosing positions that maybe are evening shift or
Yeah.
overnight shift because it just feels better and more closely aligns. But then there are some people who are morning larks who maybe have rotating shifts or maybe will work an overnight from time to time. And so the first place to start is, can you stabilize your work schedule as much as possible? Meaning, if you're going to work nights, can you just work nights versus
Oh yeah,
flip-flopping
the
to
back and
day
forth.
shift
Yeah.
or rotating, right? So can we keep your work schedule as consistent as possible? And in addition to that, can we keep the hours as consistent as possible? So ideally, like for someone who works evening or overnights, we would want to keep their sleep schedule when they're actually going to sleep the same across the day, across the week, and keep that as consistent as possible. And so that's always the first place to start. And then if we can't do that, if someone does have to work or flip flop their shifts or they're rotating or they look different or someone's traveling a lot, well, then we want to come up with a compromise. And sometimes that's, an overlap of say like 4 or 5 hours, something like that, to come up with an overlap of their schedule where they do end up having as much of a consistent sleep time as we
Okay.
can
Yeah.
given their schedule.
Okay.
And it's challenging,
Yeah.
to be honest with you. It's challenging, but that's not to say it isn't manageable.
Yeah. Okay. Yeah, I was simply just curious because I know nowadays there's everything and anything that gets in the way of us having consistency in our sleep schedules, even just simply how you sleep on the weekends versus how you sleep during the week, and your bedtime and your wake time. And I know there's so much importance in keeping those consistent. And so, it sounds to me that it is extremely circumstantial, understandably so,
Yeah.
as in anything in health, right? But also being willing to say, all right, you know what? These are the circumstances, and this is my job, or this is how it's going to work. How can I still make this happen so that I am buffering the potential for long-term health issues and also getting the sleep that you need, right? Like that is ultimately what we want is we want you to just be able to get to sleep and get the sleep and get the restorative quality of sleep that we desperately need to function. So I'm glad that you kind of detailed that a little bit. Okay, so let's transition into a topic that I find very fascinating and is pretty well known, I would say, in the functional medicine, holistic wellness world. And this is the concept of epigenetics. And it's essentially the concept of how our environment impacts our genetics. And, the one quote that I really like by Dr. Vincent Pedre, I never pronounce
Mhm.
his last name right. Genetics load the gun, but environment pulls the trigger. And I think that speaks to it to a T, like there's no explanation needed there, right? So, how do you utilize this framework to address sleep? I want you to just expand a little bit on this topic of epigenetics and testing around that, and why it's a real game changer for people in relation to their sleep and their health.
Yeah, thank you for this question. I absolutely love talking about epigenetics because, well, yes, I do think a lot of folks in the functional and holistic space are aware. There's so many people who have never ever heard of epigenetics and how, our genes don't change, but the way that they're expressed or behave can change
Totally.
over time depending on how our genes are interacting with our environment, our lifestyle, our sleep habits, our overall stress level, what we eat, how much we move during the day. I mean, so many different factors that can really change the way that our genes are expressed.
Sure.
And sleep is, of course, a really big area that, as I alluded to a little bit earlier, it's kind of the foundation. And there's a domino effect into many other areas of our overall wellness.
Yeah.
So the reason I got into epigenetics, coming from my background being more so, in the therapy space, being a clinical psychologist, and for many years specializing in CBT for insomnia. What I was seeing was that the majority of people that I was working with were improving. Their sleep was improving, the quality of their sleep was improving, the quality of their life was improving. But there was a small percentage of folks where they maybe didn't see as much improvement or, didn't really feel that CBTi was as effective as the research says it is. And what I will say is, the research tells us that 70 to 80% of people who complete a full course of CBTi will actually see a significant reduction or total remission of their insomnia symptoms.
Okay.
That right there tells us, well, there's 20 to 30% of folks that maybe aren't going to see that
Sure.
improvement. So I've
Sure.
certainly seen that in my practice where, it's like any other treatment out there.
Yeah.
It is incredibly helpful for many folks. And I still believe in how powerful it is. So I
Yeah.
know that CBTi works and can be life-changing for a lot of people. But there is this small percentage of folks where, again, they just really weren't seeing the improvement. And, just being the way that I am as a clinician, I always want the best possible results for my
Sure.
clients.
Sure.
So, it kind of led me to being more of a sleep detective and
Yeah.
figuring out like what is missing here?
Yeah. Yeah. Yeah.
What is missing from this equation? So
Sure.
I ended up going down the rabbit hole and, of course, diving into this whole world of functional genomics and epigenetics. And so I certainly, still specialize in CBTi and still do see a lot of folks in my private practice for insomnia and what would be considered more traditional sleep disorders. But there's also this other side of epigenetics that I do think is the missing link, the missing piece here. So in terms of epigenetics and how this works and how I work with clients, so I actually work with a boutique genomics company, the Designer Genes Co. And I offer DNA testing. So that's the genomics testing piece, which
Okay.
genes don't change. So it kind of gives us this comprehensive look at someone's genome.
Sure.
And taking that report and really diving into the epigenetics and what really is more epigenetics coaching. Because you could, and I'm sure many folks have done this, I have done this too, you could go to, a 23andMe or Ancestry or, Self-Decode and the like. There are many companies now where you can get a very comprehensive DNA report.
Right.
But what ends up lacking or missing from those automated tests is the human touch,
Yeah.
the
Yeah.
coding part. It's like, yes, here's your DNA, but what do you do with this
Right. The
information?
analysis of it. Yeah.
Yeah, what do you
Totally.
do with the analysis? What do you do with the interpretation and how
Mhm.
your genes are interacting with your environment, which could look
Sure.
very different depending on how old you are, depending on what season of life you're in, depending on,
Totally.
in women, depending on whether you're in perimenopause or menopause or postmenopause, depending on your stress level, right? So with the specific DNA testing that I use, the reason I chose this company was because it's actually the most comprehensive set of sleep genes that I have seen across the market. And so with the sleep genes, we can actually look at someone's chronotype, their circadian rhythm, and those specific genes. We can also look at someone's risk for sleep movement, so how restless they might be, sleep
Okay.
disruption, how disrupted their sleep might be,
Yeah.
whether or not someone's a shorter sleeper versus a longer sleeper. So there's a very comprehensive set of genes in the sleep department that, I take a look at, but it's also not just a sleep analysis. There's a full picture of someone's overall genome. So we're talking, someone's gut health and their risk for food sensitivities.
Sure.
And that goes very granular as
Yeah.
well.
Yeah.
Talking like gluten sensitivity, glutamate sensitivity, histamine sensitivity, dairy sensitivity. Also, we can take a look at someone's micronutrients and macronutrients and what
Okay.
someone's body may prefer. There's also a whole look at detox pathways, oxidative stress, hormones, and that dives into thyroid, estrogen, progesterone, testosterone, glucose. I mean, there's a big picture here.
A lot. Yeah. Yeah.
So sleep being a huge part of this, but we're looking at someone's full report. And what I then do is, provide more of the coaching piece. Well, here's your DNA, here's what your genes are telling us. How can we get your genes behaving in the direction that's going to promote overall health prevention and longevity?
Sure.
So it's very much what I like to consider more health optimization. And certainly there's a sleep optimization component as well. So it's taking into account what might be there genetically, but then actually coaching someone through what's actually going to now move the needle.
Sure.
And what I'm tending to see, in folks that I was missing when working with folks for more traditional CBTi, now I'm actually seeing that in a lot of cases of insomnia and sleep issues. Well, it's actually someone's glutamate sensitivity. So they're eating a lot of food
Mm.
that cause this excitatory neurotransmitter to keep their brain very active.
Yeah.
And so now I'm seeing, well, wow, it's actually tied to what someone's eating a lot
Yeah.
more than I thought. Also, the glucose and hunger and satiety hormones.
Sure.
And we can see genetically, but also what that looks like when someone, is already doing all the right things, like where to go from there. And so it
Sure.
really provides this other layer of
Yeah.
whole systems view that is likely missing from more of that standard of care and more the traditional side, which again can be incredibly helpful and life-changing for a lot of folks. But this is what I like to consider the icing on the cake. It's like,
Yeah.
well, if you're still experiencing some form of a sleep issue, there's probably something there
Sure.
that can pinpoint that maybe isn't necessarily a dysfunction in the sleep genes, but maybe
Yeah.
there's something else lifestyle wise that we can now really focus on that's ultimately going to improve your overall sleep quality.
Sure. Yeah. And that is just insane, right? Because I think that is something else that we don't understand collectively as a population, that the contributing factors to insomnia or to some sort of issue with sleep, there's just a multitude of them that could be there. And for something like the glutamate example, like how would you have otherwise known that unless you did the testing? It's not like you would immediately, oh, an
Literally.
average person just be like, oh, maybe it's this, right? So, bringing in that extra level and layer, I mean, I feel confidently about this and as it relates to anything out, even non-sleep related, right? To better understand like what testing is there. And instead of this guessing game, instead of this, I'm trying everything, it's not working, and really kind of just continuing to hit that brick wall, let's take it up a notch and look a little bit closer at the genetics or at this, deeper layer of testing that will give you more information, more insight, because it's all connected, right? I think a lot of times people aren't going to make that connection between, oh, what I'm eating and my sleep. It's no, there's a tremendous connection there. So I'm glad to hear that that's something that's utilized, because I would argue that it's imperative. I would argue that it has to be something that becomes normal within our healthcare system, in order to really heal, in order
I
to really get to
agree.
the bottom of it.
Yeah, I agree wholeheartedly. And especially now that, there's so much that we can see within someone's DNA report and using that as information because
Sure.
that doesn't change. But of course, depending on where someone is in their season of life, it's kind of like a blueprint, a
Yeah.
whole blueprint. So, this was the case in a couple of my recent clients, younger clients who maybe are eating a lot of things and not really thinking about it. But then in the genes, we can see that there's actually an increased risk for gluten sensitivity and some other areas. And so, for these types of clients, they're not really noticing an impact,
Sure.
but maybe 20, 30 years from now, when they eat something that's high in gluten, their genes might be behaving or expressing differently. And
Yeah.
so you can always go back to this home base, this blueprint as a
Right.
guide. And so I do agree with you. I wish it was a standard of care now that I've seen
Yeah.
how intricate we can see into someone's chemistry.
Yeah.
If we all knew what we maybe are a little bit more deficient in at baseline,
Yeah.
especially in the case of like vitamins and minerals, if we all knew that, that would save us so much time
Mhm.
and money, especially on like vitamins and supplements and things.
Yes. Oh my
People are
God, yes.
guessing about what things they should be taking. But with
Yeah.
things like this, we can actually see what someone should be taking at baseline to support their chemistry.
Yeah.
So it's very precision based, and yeah, I absolutely love it and wish to
Yes.
get it in the hands of as many people as possible.
Yes, absolutely. I just had genetic testing done last summer, and I learned a lot about my detox pathways and susceptibility to oxidative stress and all these different, you know, areas that I really should be investing more of my focus in. And obviously, I'm doing it just based on my personal interest in health and the work that I do. But it really completely changed the way I saw what I was doing, how I was supplementing, when I really learned, like, okay, this is an area that needs extra support. And it makes sense if I look back over the course of my past 10 years, the issues that I went through without really any knowledge of whole body health and so forth. It kind of makes sense why so many of these issues took place because of the fact that my genetic makeup looks the way that it does. And I think that this has been really, really transformational for me now moving forward to know like where do I need to spend a little bit more extra time or maybe more money or incorporating certain foods that help support that process because otherwise I would have not known, and it would have obviously, I would have survived. I would have been okay, right? But I can now take it up a notch, and I
Yes.
hope to one day be able to offer this to all of my clients as just kind of like, let's get started just by looking at this so that we know individually where we can best get started in supporting you. And I agree with that. I agree with GI maps and understanding your microbiome a little bit further. I mean, testing across the board. Now, that's a whole different ballgame for me to get into with getting certified and getting the credentials to do that. But I do foresee myself doing something like that because otherwise I feel like I hit brick walls with clients where I'm like, I can't do anything more unless we know what's going on underneath the surface. And that, comes with a cost. It comes with complexity. So, definitely a future goal of mine, but just from my own experience, it's been really, really eye-opening. And I'm grateful because I can do something about it now as opposed to just let it kind of be and then probably manifest down the road in other issues, you know?
Yeah, no, I love that. And certainly, with any type of testing modality, going to look different and from person to person in terms of what might be the most appropriate. But yeah, I think just as kind of a blanket statement, test, don't guess, because
Yeah,
there's so much that we can see from testing. And I'll say on the other side of this, sometimes people forget that even without doing the testing, which can sometimes be very expensive as
sure.
well, the foundations of a healthy lifestyle are always a good place to start
Yes, to start.
and
Yep,
dial those in, because there's still a lot there that a lot of folks forget about. And I get it. I mean, as humans, being consistent with any lifestyle change can be challenging, especially in the beginning. But once it becomes part of your routine, the foundations will serve you well and they'll serve most people.
absolutely. Absolutely. Couldn't agree with you more. I think that that's a big issue in terms of how we approach health. We want the latest supplement. We want to be doing all these things that go far beyond the basics. But if we start with just the basics and build the foundation, like you're saying, that is, the best, most effective, most accessible way for us to get started. And then we can go from there. I think that that is ultimately the best advice I think that can be given. Solidify your nutrition, get consistent with your movement, address your sleep, and then go from there. Definitely. So I want to merge my final few questions for you. I'm interested to hear a little bit about your work with clients and what you've learned over the course of your time as it relates to sleep and being firsthand experiencing, you know, client interactions and what they've taught you, I'm sure, in a lot of ways, because I think we expect that we can learn everything from a textbook, and that's obviously not the case. But then alongside that, based on those experiences, are there any actionable tips that you can draw from based on the experiences or just based on your work that would help someone improve their sleep quality?
Yes, absolutely. So what I've learned over the years, and I think you actually mentioned this a little bit earlier, there isn't a one size fits all approach when it comes to improving sleep. And I think a lot of people get discouraged when maybe they have tried a lot of the sleep hygiene tips and, general sleep advice out there. And again, that those are really important things to keep into practice, and great if you already have good sleep. But if you really are feeling like your sleep is disrupted, or it's just not the greatest quality, or even after a full night's sleep you're waking up feeling exhausted, there are a lot of other things that you can do. And it really is more so about finding the right provider, learning the right specific strategies, getting the right support, which also involves changing mindset and beliefs around sleep, but it is very possible. But there just isn't a one size fits all. So it's all about how to make what we know to be effective work for you.
Sure.
So there isn't a one size fits all. And also, when it comes to the number of hours of sleep that we get, yes, that's important. But the quality of sleep, I could argue, is even more important, because even for someone who maybe is getting enough sleep, if the quality of that sleep isn't great, still not going to wake up feeling refreshed
Sure.
or well rested. And that's also another thing that I think my clients have taught me over the years is, just because we all tend to hear others say, we'll wake up tired or just go through our day tired, that it's normal. And it is absolutely not normal. It's common, but it's not normal, especially after a full night's sleep. If you're waking up feeling tired or exhausted, then I think it's worth getting an evaluation,
Yeah.
and perhaps starting with a sleep specialist and then going from there. So not normalizing the tiredness and the fatigue that I think a lot of people are walking around with.
Totally.
Um, and just as a last note there, in terms of what my clients have taught me and what I've learned over the years as well, kind of speaks to another area that gets normalized: snoring. When snoring is
Mm,
present, snoring is a sign. Snoring is never normal. And I think we tend to think about it as, oh yeah, so and so snores, or we'll, if our partner snores, we'll just, turn them over. But snoring is often leading to a little bit of sleep fragmentation. It leads to these micro awakenings during the night. So even if
yeah.
the snorer doesn't realize this, they're not getting the best quality sleep possible.
Sure.
So that doesn't necessarily mean that someone has a sleep disorder like sleep apnea, for
Right.
example.
Right.
But snoring could indicate that something's going on in the airway, or there's just something going on that's worth looking into. And that goes for any age,
Yeah.
any size. Sleep does not, discriminate. I mean, I've seen very young babies and kids who snore. So it's not, it doesn't matter how old you are. It doesn't
Sure.
matter, what you look like. It is often a sign. And so it's
Yeah.
something that we, tend to normalize as a society, but it's certainly worth looking into.
Sure. Totally. Yeah, I appreciate that. I think, symptoms are messages, right? And I think you're right about the normalizing of, I mean, beyond sleep, right? We normalize everything, especially when they're subclinical, they're maybe not so much diagnosable. They're just kind of like, well, this is just how it is, right? This is just how I live my life. I always feel this way after I've eaten this, or I just don't wake up feeling rested, like you said, right? Like there's a number of different justifications that we've given ourselves to, why we feel the way that we feel. And I think it's really important that we start to question that, call that into question, and look at
Yeah.
that a little bit closer, because I think oftentimes we're overlooking that there is imbalance, or there is dysfunction, or there's something going on. And yes, it certainly does take a little bit more time, but the outcome and preventing the perpetuation of it too means that down the line, our health will remain intact and we don't have to worry about long-term health issues and so forth. Because oftentimes that's kind of how the snowball unfolds. So I
Mhm.
appreciate those suggestions and whatnot. Anything else, Sarah, that you feel like would be relevant for the audience to hear about sleep, to know about sleep, to take away, encouragements, anything of that nature?
Yeah, well, I always tell my clients this as well, but good sleep begins in the morning. So I know
Mm,
we can think about sleep as, what we do before bed and, our actual sleep time, which is very important,
sure.
but your body prepares for sleep once you wake up in the morning. So waking up in the morning, your brain is already, starting to prepare the process for that following night of sleep. And really what we do during our day has a huge impact on
Yeah,
that next night of sleep. So waking up at the same time each morning is ideal. And I know sometimes that isn't necessarily realistic, but sticking to that as best as you can across the week because our bodies don't know the difference between Monday through Friday and the weekends.
yeah,
Our bodies just know that we're supposed to be on this 24-hour-ish rhythm. And so that's always a great place to start. That's kind of
sure.
a foundation in terms of what I like to call anchoring your circadian rhythm each morning. So keeping the same wake up time across 7 days. And then light is also a huge area that we could probably have a whole nother episode on
Yeah,
from a sleep perspective. But really thinking about your overall light exposure during the day. And I know there's so much harp on artificial blue light and yes, it's important to, be mindful of that in the hours leading up to bedtime, ideally after sunset, starting to reduce screen time and minimize that artificial blue light.
sure.
But blue light, even in and of itself, is important. We get our blue light from the sun, and we need that light to really help communicate to our brain what time we should be sleeping. And so to pair with the keeping of the same wake up time each morning, I always like to encourage folks to think about getting morning light within that
Yeah,
first hour after waking up. That really helps so much from a sleep perspective. I mean, it really does help for many different reasons, but specifically, it helps trigger the cascade of hormones that are involved in the process of sleep. So if you can get your light around the same time each morning, in theory, you'll be getting sleepy around the same time each evening. And so the
sure.
more consistent you can keep those, the better you'll feel.
Yeah, yeah,
So those are my like two foundational sleep tips, if you will, but they really are so vital to just giving your brain the right signals and
yeah,
ensuring that you have the right light exposure.
yeah,
Most people are inside all the time, and I get it because we live in a world where a lot of us are on our, computers all day. We're not getting enough blue light from the sun, and
yeah.
that's really starting to have an impact on our sleep quality.
Yeah, absolutely. I think, just seeing the sun as our master regulator, I think that that's enough for us to say, all right, this makes a lot of sense. And so when it is daytime, I should be exposed to the light so that my wakefulness is there. I'm alert, I'm ready to go. And then winding down at night and allowing, proper melatonin release and
Mhm.
to be sure that there's that balance, and that the rhythm of our inherent clock or innate clock is doing what it needs to do to support good quality sleep and to wake up feeling refreshed and all that. And I think there's that inherent fear of the sun that we all have now with as it relates to our health, but I think that's a big and outside of just working inside, working from home and so forth, that obviously inhibits our ability to get the natural sunlight, but being willing to get
Mhm.
that exposure, that's something I am a big believer in. I tell all my clients about, so I'm glad to hear that you've reinforced that for me as
Yeah,
well.
absolutely.
All right. Well, Sarah, this has been so great. I'm so excited for this episode for my audience to take a listen, and I hope this isn't the last time that you join us here. Where can everyone find you? I would love for you to kind of share where people can connect with you.
Yeah, well, I'd love to come back and chat with you again. So thank you. I am at Dr. Sarah Sleep on socials. I'm the most active on Instagram, but you can find me on your favorite social platform, and I'm there at Dr. Sarah Sleep. And yeah, I'm always happy to be a resource to folks just because there's not many specialists like myself. So, even for folks who maybe are trying to find a local provider, I'm always
Sure.
happy to connect because it's still hard to find us. So always happy to be a resource to folks. So yeah, can answer questions and help connect folks to CBTi specialists.
Yes, I love that so much. And for everyone listening, I will put all of Sarah's information in the show notes so that you can take a look at it there. And like Sarah said, I'm sure this won't be the last time that we have some good conversation around sleep and the importance of sleep and so forth, and just continue to dive into this message because it's so under considered and under talked about. So whatever we can do to get the message out, I'm ready to do it. But thank you so much for listening. Thank you so much for tuning in. And until next time, thank you for being here and be well.
Thank you, Emily.